our kind of our second edition of what we're calling the injury management call. So we have athletic trainers that are all over the country, and then we have a couple coaches that have joined us today. So welcome, both of you. Real quick background around the concept, and then we'll just dive into content today. And then when each of the athletic trainers start talking for the first time, then give a little background about yourself. So we'll kind of just expedite it that way instead of doing the round table from the beginning. And then at the end, if any of the participants, Braylon or Dustin, if you guys have any questions or want to dive a little bit deeper, let us know. So once again, my name is Adam Halpern. I worked at Stanford. I worked with the US ski team as an athletic trainer. And what I realized was that level of athlete receives a level of accessibility to healthcare that is all around high quality information, expertise, getting the athletes better as fast as possible, and most importantly, really expediting them through the healthcare system to get them back onto the field or court as fast as possible. So all of the athletic trainers on the phone have master's degrees. We've worked in professional sports, high-level collegiate athletics. And when you step out of that environment and you enter the healthcare system and just public recreational sports and amateur sports, the experience that those athletes receive around injury management, injury treatment, navigating the healthcare system is completely different. So what we're doing with this service that we call WaveOn is we're bringing this high-level expertise, this high-level connectability to every type of healthcare discipline possible, and we're bringing it to millions of amateur and recreational athletes. So this call is one of the services that really highlights that we can help people with minor acute injuries or chronic injuries or overuse injuries just by giving them information about how to properly manage it. Athletic trainers are highly skilled healthcare professionals that receive education, degrees, national certifications, and are actually licensed in most of the states across the country that we work with healthcare professionals, and we're really experts in musculoskeletal injuries. So we just sat back and said, why is it only high school and college athletes that receive this level of service? Let's bring it to millions of amateur and recreational athletes ranging from 15 years old to 85 years old to help them improve their sport performance, improve their patient outcomes when they do have an injury, save a ton of money in the healthcare system. And when they do need to see a specialist, we can get them there as quickly as possible to save a bunch of steps to see that specialist. So it's a pretty unique service we're bringing to the community at large, and we appreciate all you guys joining. So today we're going to dive a little bit deeper into the conversation around how to properly manage acute versus chronic injuries at the house. Last week we talked a little bit more about the psychology around being at home during social distancing. So this week, the panel of athletic trainers wanted to dive a little bit deeper into when you do receive an injury at home, how do you properly manage it with some of the tools and resources that you have in your house. So with that, which athletic trainer wants to get started just to kind of talk about what they've been doing with some of their athletes currently?
Adam, I can start because I have a great example. I'm Nora. I'm a licensed athletic trainer. I'm in Denver. I used to work at the Mayo Clinic, University of Denver, and University of Wisconsin at Madison in the private setting, and also have some active athletes on WaveOn that I'm coordinating their care. And recently had an athlete who strained his calf. In addition to making sure that it was very minor, there's a lot of things that he could be doing at home, which he has been for the last 3 weeks, and with my guidance. And I just want to open it to the floor about, we used to think RICE, the principles of RICE, were the bread and butter, rest, ice, compression, elevation. And actually, with recent research, we found that a couple of those letters need to leave and a couple of those letters need to stay. So especially compression and elevation, and another one is actually what we're finding instead of rest is what we need is movement. So I came across a research article that examined many athletes. They were exploring active recovery, And a part of active recovery that they were examining was contrast water therapy. So going back and forth from hot, cold, as a recovery option versus complete rest after exercise or after an injury. So the research trials suggest that muscle soreness, muscle damage, strength, and power all appear to recover more quickly after contrast therapy compared to no intervention at all or just rest. And you don't have to just use contrast water therapy. It's really anything that creates movement and circulation in the system. So what I had this athlete do is contrast water therapy. Also, he has a mountain bike, so I had him do some light biking, pain-free outside, and also wear a compression sleeve. And so also that article suggested that doing a combination of a bunch of things was better than just one intervention alone. So that's a big thing that we are discovering is we actually want movement instead of rest. So pain-free movement. And then also there is some injuries that require rest and deloading, but definitely consult with a professional on what it means for you.
Does anyone else want to add to Nora's thoughts around the treatment of the calf injury? Sarah, yeah, go ahead, Sarah. You're on mute.
Thank you. So I just wanted to kind of, I guess, piggyback off of what Nora just ended with there of like knowing general principles is going to be really great, but then also like feeling like you have somebody to consult with, like a professional to consult with about your injuries and the management of them and which things apply and which things might be a little bit different. I think is always really important to keep in mind of that. Every injury is going to still be unique and still like there are going to be things unique to you that will facilitate your care better than other things. So I just liked that she kind of highlighted right there at the end.
No, that kind of brings up a quick question, and this is to the panel of athletic trainers. What have you guys experienced when an athlete tries to self-treat by looking on the internet and finding how they should treat a general injury? And then what has been some of the outcomes when they've come to you? Tyler Rees-DeSant, give us some.
Kind of what you were saying earlier, like the bread and butter used to be, everyone thought rice for treating injuries. And a lot of times when you look up those, how to manage it yourself, you're doing things that are maybe outdated. And we recently found acronyms such as, like I use PEACE now instead of ICE. And you're just doing things that are maybe not even applicable to your injury. I know a lot of people that I work with use rice if they have chronic knee pain or acute. And kind of what Nora briefly touched on is talking to someone who knows how to handle the situation is important, because resting the injury may not help at all. If it's a chronic situation, it's probably not going to. So a lot of people are just mistreating their injury or using approaches that maybe they're just throwing things at a wall and hoping they stick, and it can just take a lot longer to get the benefits they're looking for.
Before we go to someone else, what does PEACE stand for?
It's protect, so avoid de-injury or avoid painful activities. Elevate, like Nora said, elevation is shown to be really good at reducing inflammation. And then A is for avoid anti-inflammatories, and that doesn't mean completely avoid them. It's avoid unnecessary use of them. So not over-icing, not loading up on things like ibuprofen, things of that nature. Compress is what the C is, and then the last E is for education. Is educating yourself on kind of like what you said, how to properly implement the above letters.
Cool. Yeah. Josie, it looked like you were trying to maybe get off mute. Do you have anything else to add?
Yeah, I think Tyler brought up a good point there is the acute versus chronic. I think a lot of the times, unless you're an expert, you don't really understand what acute versus chronic is and like what the proper treatment route is for at home. So, understanding that the acute treatment you really want to focus more on the inflammatory phase of what's going on with that injury versus the chronic. We need to make things stronger or more movable around that area. So it's like, make sure that we're educating them, which I really like the acronym PEACE at that last portion. I always think education is number one. And so it's getting people to understand the acute versus chronic and what type of injury they're having and to guide them in that home care that they're doing.
Just for this purpose of this call, because it is education, you guys give a quick explanation of the difference between acute and chronic, and then how that leads to the definition of overuse, because that's what we talked as a panel yesterday. let's discuss that for the listener so they understand how to identify their own injury. Who wants to go?
I can just expand on that a little bit. And one thing I try to stress to athletes is whenever they have an acute injury, and this ties into our previous point we made about RICE in the acronym piece, is acute injuries, they do get better with a little bit of rest. So like we would call a fracture acute because there was a certain instance that happened. An ankle sprain, that's an acute, you need to stay off of it. That happened in a certain instance, and staying off of it is pretty beneficial. But what really won't help with rest is chronic injuries, so overuse. So these are ones that you can't remember a certain time that this happened. So examples of this are patellofemoral syndrome, which is like a blanket term for knee pain. Achilles, any of our tendinitises or tendinosis, and what those result from are mechanical issues. So what I like to explain to our youth athletes is our body will always find the path of least resistance. So if you ask it to do something, it will find the best way to do it. And it's not always the safest way or the right way. So my analogy is if you want to go to the grocery store, you take the quickest route. You don't take the longest route. And that's exactly how our body works. So if you're a volleyball player and you are an outside hitter and you keep hitting, you might not be doing it properly and you don't even know it. The only time you know that it was wrong is when you have pain. So that's when your body's telling you, well, I found this shortcut, but it's not the most efficient, it's not the safest way. So, so then the ways that you can correct chronic injuries are appropriate stretching and strengthening, which is a very hard thing to understand what strengthening and stretching you need to do. So that's where we could come in. But an important thing here is that rest will only temporarily help your chronic injury. But when you go back, it's likely that those symptoms will return.
And that kind of goes into what we talked about last week. A lot of the athletes, young, old, are sitting around all day right now during social distancing. So then when they get up and they start to become active again, certain muscles might not be turned on because they've just been sitting dormant all day long, which can then cause the body to go towards that path of least resistance, which can then cause an injury. So it might be kind of a combination of acute immediately, but then it becomes overuse because of our daily patterns during the social distancing. Anyone else have any additional thoughts off of what Nora mentioned?
I think to add to what Nora was saying, another thing I see a lot of people encounter is they think they have an acute injury. Like, oh, my son was throwing a baseball and he threw this pitch and he had a lot of arm pain. But sometimes it's important to look at what caused that acute injury. It could be what Nora was saying, a bunch of chronic issues or an over and over again incorrectly done movement that causes it all to show up at once. So that's something to take into consideration too when you're looking at your injuries.
So what are some of the suggestions we can give the listeners when everyone is by themselves, everyone, can't be around a team or a coach, but they want to continue to stay active and they don't want an injury to slow them down, and they might have some muscle imbalances? What are some of your suggestions that you guys are giving your athletes? Josie.
Right now, I'm actually dealing with a variety of athletes from the professional level all the way down to an 11-year-old tennis player. So like what we're seeing is these guys that go at the higher level are throwing, but they're not throwing as much as they would be because they're amidst a season right now. So they're kind of like, they're getting sore unnecessarily than they would prior to this. So what we've been doing with them is just teaching them how to recover. And so educating on like recovery strategies after participation of what they're doing. So for example, a lot of the times for baseball players, I've been teaching them, certain shoulder programs that they will do. So a lot of the times we know the Throw 10 program or like the band series. And so I'll teach them, they'll go do that. Or my younger athletes, we've taught them how to, they'll do like active dynamic warm up when they start. Well, let's do that as a cool down. And so to manage these injuries and unnecessary soreness, because one day they may be like pushed a little harder, and the next couple days they may have gotten lazy because it's easier right now. We're trying to keep them moving and active so that inflammation doesn't sit within the joint, so they don't get that delayed muscle soreness, to help them out later on as they start training throughout their week.
Good feedback. Catherine, is there anything else that you want to add with your professional sports experience?
I think Josie just hit the nail on the head, and basically exactly what I've been, almost probably word for word, what I've been telling my athletes to do. And it's really one of the things that they're struggling with is they forget to recover. You know, they're sitting around there on their computers or watching Netflix or whatever they're doing all day, and then they go and they do their workout, and then they're like, all right, we're good. And they move, you know, and go back right to the couch, and just reminding them to take that time to recover, take care of their bodies, and that it's important now, even though life is so different and so just kind of strange, and they're not in their routine. They're not in their normal rhythm. They're supposed to be mid-season right now. So they're in that same kind of mindset.
With many states that are now opening up again, starting May 1st and in the middle of May, that means some of these coaches are going to be able to get their athletes together and do some practices. What suggestions do you guys have for the coaches and the parents to ramp up their athletes appropriately to decrease the rate of injury, because they haven't been at that level of, you know, speed and force and power for a couple months? What are some suggestions you guys have? Noah raised your finger first, so.
Yeah, and I was talking to Dustin, I don't even know, was it last week or the week before? I can't even keep track of time now, but one thing that Prodigy Softball is doing, which I think is great, is making sure that they have X amount of practices before they go into games. So I think that's a really important part. And starting with, I mean, there's all different kinds of sports, but taking softball, for instance, is starting with the accessory movements. So not getting into live play, getting into the skills that require repetition and volume, such as catching and throwing and batting, and then eventually pile on the live play before, and practice before going live play in competition. So progressing them accordingly in steps is a good way to prevent some injuries. And I'm glad that especially Prodigy Softball and Dustin, they're thinking about this. And I think it's a great thing to hear that organizations are being mindful of the situation that we're in.
I think you had something, Sarah, you wanted to say. Yeah.
Yes, I did. Thanks. I think especially for like the gymnasts that I've been working with, I think a big thing that coaches can do to help prepare when we are able to go back is just recognizing that there's going to need to be a time of preparation, because you don't know how much each individual has kept themselves prepared. So just knowing that and being willing to like sit down as a team or as a group and like have that conversation of like, we know that we're going to need some time, and you know, each of us might have done different things, but we're going to work together to prepare ourselves again. So making it like a team effort and like a team conversation of like, what are we going to do? What are our goals for this? But then also, I think it's really important, especially for again, like gymnast population or volleyball players, people are doing a lot of like repetitive jumping and landing, that we're going to have to build that back up, like building up plyometrics again, the body's ability to handle like repeated force and the timing of how quick can I land and rebound or jump back up, because that's definitely gonna have suffered if they haven't been keeping that up, and that's a huge area for injuries. So I think that's probably a key point for those repetitive jumping sports.
Good feedback. Tyler has something.
One thing I've been talking with coaches about is going with what Sarah said, is just being patient. One coach I talked to, I got him to understand that if we can prevent an injury, that's the best way to manage injuries for his team. It goes a lot further, and it's a lot easier to prevent than it is to manage it once it occurs. But one thing he's having to deal with is understanding these athletes are not acclimatized physically, but environmental conditions depending on where you're at. So baseball tournaments coming up, for example, he's going to skip one of the first opportunities as of now, just because his guys have been sitting inside in the air conditioning. It's not something that spring sports usually have to deal with. That's more like a fall sport thing for your high schools. But he's having to factor that in, because once you get young kids out there and they start fatiguing quicker, you're more likely to get those injuries. So just getting exposure to the elements and spending that time in the game-like situations is going to prepare them.
That's good. Josie or Catherine, anything to add? Catherine?
I've been talking to my coaches about making sure that we set up really kind of methodical warm-ups and cooldowns. They typically are not as guided, but that our players, especially our younger players, are going to need that step-by-step kind of guidelines. Again, just kind of the refresher to make sure they get back in that routine and that rhythm, so they're not skipping anything that'll help prevent injuries as they get back into it.
Good. Josie, anything to add?
Yeah, one thing I've been speaking with some coaches about, especially at these high school levels, because they're getting ready to get back into the summer leagues if things open up here in Arizona, is educating the parents on the transition. So we know that things will happen in practice. So depending on what the coaches are going to do within practices and the repetitiveness that they're going to have throughout their weeks or the weekends, is educating the parents on the progressions that these kids have to do. So that way they're not going home and doing all this extra training, because I've run into situations where the coach will have a plan for them, but the parent may have a different plan. And so they'll do stuff at practice and they'll go home and do more. So it's just getting the coach and parents to communicate with one another on, we may be, for example, baseball is coming up. So we know that the repetitive motion of throwing in a young athlete is, we have to watch out for that. So what they're doing throwing in practice, how much extra doesn't need to be done at home versus what maybe need to be done at home. So having that communication between the coaches and parents is something that they could really do.
Yeah, that's a really good point. That's really valuable. And with that, I'm going to open it up to the listeners. If you guys have any questions from a parent or coaching standpoint that the panel can help you identify how to move forward. You guys have any specific questions? It sounds like we don't have any questions. Is there anything else that you guys want to add, athletic trainers, to help them with the next couple weeks as the world starts to open up? No, we touched a lot of points. Yeah, so that was, oh, go ahead. Oh, never mind. I thought someone was going to say something. No, Dustin is.
Yeah, so actually, jumping on with your guys' call again, it's very, very informational for me as a coach. But pretty much what all the other trainers and everybody has been talking about, I've already implemented for my team. I've been in, close contact with my parents, letting them know that I've got specific workouts they can do at home. We just started, now that we're on lockdown again, and for our sport, we can't start now until June 1st. So I've got, girls as a team doing yoga and strength and conditioning together. So we've been doing that, and then kind of jump on what Nora said. Our organization is 100% towards these girls, and with tournaments at for the higher level teams, his expectation is no traveling unless we have at least 1 to 2 weeks worth of a good solid practice to get these girls back to where they need to be. So everything you guys have touched on has been great, and kind of what we've, as of my team, we've been implementing already. So this is really, really good information. I guess my only question would be, I've started them doing yoga to kind of get them, their bodies back into shape, and then going into a 20-minute high-end workout with a 2-minute cool down. Is that something that you think is okay?
You guys want to discuss it?
I'll hop in. Yeah, that sounds great, Dustin, of a combination of mobility and strengthening. I know, especially like even maybe a few of your girls, I just try to educate to them that, because a lot of them want to cross train with yoga, and especially female athletes, we tend to gravitate towards things that we're good at, which is things like mobility and movement and stretching. And male athletes tend to gravitate towards what they're good at, which is hitting the gym and bench pressing and deadlifting, and when actually they probably need to be in yoga. Everybody needs to flip-flop. So especially like your pitchers, which is one is your daughter, is highly concentrate their daily regimen around strengthening and activating those muscles as well. And definitely with the pitchers, because they have a specific movement and they need a little bit more strength at this point in their life than mobility. So I would say try to switch some of the regimen on strength at this point and revving up that way. But both is great. I just think sometimes our female athletes gravitate towards what they're better at, which is mobility and yoga type situations.
So incorporate a little more weights.
Yes, not only weights, but also strengthening the accessory muscles like the rotator cuff. Some of those smaller muscles that really you can't focus on firing them with things like your conventional upper body lifts. But those are really important muscles for the pitchers to orchestrate that arm movement and keep the shoulder where it should be. But so in addition, those big muscles and the little muscles.
Okay.
Keep it simple.
Thank you.
Panel,
That's a great
do you guys
question.
do you want to add anything just about the blend of yoga and strength and other workouts together?
I'll add, I think having your athletes do the blend of the yoga, the mobility, and the strength training, I think is awesome and phenomenal. And especially when talking about some of like the biomechanical errors that lead to the overuse injuries. I think by a lot of the time, like recognizing where your body specifically is lacking in some of its mobility and some of its biomechanical movements, like that is really beneficial for the individual. So I think that sometimes like spending the time on the mobility, like not neglecting the strength training, because that's going to go a long ways too, but spending some time like doing that mobility work and realizing like, oh, like I feel like I have a hard time like twisting my upper back, like, and so if they are a pitcher, if they're having a hard time like with their thoracic rotation, their upper back rotation, then that might lead to some of those biomechanical errors in their throwing. And so just like spending some time noticing for you personally, like where you can work on your mobility, I think can go a long ways in helping you put together the pieces of somebody's story to understand your athlete.
No, that's helpful. I'm going to ask Beth a question just because of your group and all the parents that you're around. Have you received a bunch of questions that we can help answer to enhance your community's knowledge?
No, actually, I haven't yet, but I think it's because they're not educated and informed on the questions to ask.
Mm-hmm.
So I think that's probably why.
No, that's a fair statement. Yeah, if you don't know what to ask, you don't know where to even start. Is there something that we can help in that regard, just because of our expertise? Like, is there a way to have parents start to think differently that we can bring value to you and that group and other parents across the country?
Yeah, that's a really layered question. I don't know that I can answer. And yes, there is. How? I think I have to think about that. I do have some ideas, but I have to think about it a little bit and kind of formulate. Because what I think, again, is that what you're doing is so new that I don't even think they know to ask for it or that it's available and how to access it. And so I think it's just getting the information to them. But best way to do that, I have to think about that, because they're just inundated with information. And so what's the best way to get it to them that it cuts through all the noise?
No, that's totally fair and makes total sense. I think the big thing that we're doing differently, because when you said it's so different, we're focusing on prevention. And prevention isn't just preventing it from happening, but it's also preventing it from getting worse, from happening again, and then preventing long-term high medical expenses. that the sooner they have early intervention from one of the, you know, the expert panelists, and then if we can help them see the appropriate specialist early in the injury phase, then everybody's going to win. And that's just more of a proactive approach around injuries when it's usually been a reactionary approach. So that's the biggest difference that we're trying to create in the marketplace, because there's athletes get it every day, but like we talked about at the beginning, it's not for the average athlete. It's only for major organized sports. So it's 10:33 in my time. Does anyone have anything that they want to final discussion point? We're going to move these to once a month. That's kind of for the audience. So then we can really have more focused conversations around maybe one particular topic once a month. So we'll keep you guys all informed around that. But if anyone has last minute comments, just unmute yourself. And if not, we'll look at the May meeting and I'll send out invitations. But I think these are really exciting. Like Beth and Dustin mentioned, we're definitely helping you guys understand either what to do, or to Dustin's point, you might already be doing it. And we're just validating that you're an intelligent coach, you're an intelligent parent, and to have the expert say, yeah, keep on doing it. That's just validation to say you're looking at it the right way, you're supporting your parents, you're supporting your athletes. And we're, like we said last time, we're all in this together. We're all trying to help these athletes be the best that they can be. So to really lock arms in a supportive approach is really what's going to make the big difference for everybody. So once again, if parents, coaches, if you have any interest about WaveOn, WaveOn.care, really what you receive is unlimited virtual access to the athletic trainer and then unlimited referrals to specialists. So not just when an injury occurs, but when there's the earliest sign of discomfort, that's when this early intervention is really going to pay dividends on the long-term outcomes. And that's really what we're trying to create. So you can go to WaveOn.care. You can see this group on the screen that's up on the website. We're building out more tools and resources for you as a parent and a coach and the athletes themselves. So we're pretty excited about the future. But with that, we appreciate you guys joining, and we'll stay in touch for the next call. So thanks, panelists, and thanks, listeners. Talk to you soon.